The first thing we need to organize is the position that the mother is to be in. In this video, we're demonstrating the vaginal breech delivery with the mother on her back and the legs up in lithotomy position. So as she's pushing, keep the hands off and await events. Now sometimes you don't require any other intervention at all and the baby will deliver on its own. But for the purposes of this video, we're going to demonstrate some of the maneuvers should you need it. So the first thing we're demonstrating here is to rotate the back to the anterior. Only hold on to the bony pelvis. This is to avoid bruising in the baby. So we're turning the baby so that the back is facing upwards. There we go. Should the back face downwards, then it won't be possible to deliver the baby, so this is an important step. Now we're going to assist the delivery of the legs. Place your finger behind the leg and push behind the knee to lift upwards. This causes flexion in the knee. Now one leg's delivered, we'll show the other side. Again, we put one finger behind the knee, holding the femur so it splints the leg so the leg doesn't break, and pushing upwards there, so that delivers the other leg. Now we've already rotated the baby into the side position to allow the release of the right arm. And now we're sweeping our finger over the top, down into the elbow, pushing downwards to release that arm. Then we lift up 30 degrees, rotate all the way round so that the other arm, shoulder is facing upwards, and then pull down again, and then use your other finger to release the other arm, pushing downwards against the humerus. Now once we're in this position, we can do this maneuver to deliver the head. We deliver the head by flexion. So we put the middle finger on the back of the head and the middle finger and index finger at the cheekbones, not in the mouth, as was previously taught. And we push down and pull with those fingers. So rest the baby on your right arm and put the position, the fingers as we'd shown, and really flex the head for delivery. Now sometimes this doesn't work, or you may choose to use alternative technique, and the forceps is a good alternative. So you ask your assistant to hold the legs, and so the baby's in upwards position. You apply the forceps as you would in a normal delivery by using light finger touch and inserting it with the thumb. You're putting the left forceps first. We of course check if the forceps are matching pair and that they lock. Then using the right forceps, again putting gentle pressure with the thumb, inserting the forceps blade around the baby's head. You may need to do an episiotomy. Then using the right hand, pulling horizontally and using the left push downwards, you bring the baby's head up and then you lift upwards. Try and flex the head. Support the perineum. And there we are, we deliver the baby.